Okay, I think we will get started. Looks like we have critical mass. So, good afternoon to everyone in Zambia. My name is Sean McIntosh, Director of Public Affairs at the U.S. Embassy. I know it's been some time since I've seen much of you all. Had a change in family, which required me to come back to the United States, and I'm still here because of COVID-19. Today, we will have a discussion led by the U.S. Charge d'Affaires, David Young, on U.S. assistance to Zambia in response to the COVID-19 pandemic. I want to first go over some ground rules, then allow the Charge to give his opening remarks and allow as many people as possible to offer questions and answers. So for this call, we would like the focus to be very much on COVID-19, U.S. government health assistance, and if you have any questions about Earth Day, you can ask that as well, since Earth Day was yesterday. If you want to ask a question, please you can either use the chat feature to type something up, or you raise your hand and ask a question verbally. When you ask your question, please state your name, media organization, and then your question, especially when you're asking it verbally. I don't think it's necessary to state your name in the chat, but as long as at least you state your media organization. Also, ground rule, we would like to see as many people as possible, so if you can turn on your video feature, that would be fine, but keep your microphones on mute until it is time for you to speak. And lastly, we want to limit questions to one each to allow as many people to ask questions as possible. If you have natural follow-ups, we'll definitely entertain those. Before we move on, just want to make sure, does everyone understand the house rules? Okay, so at this time, I would like to turn the floor over to U.S. Embassy Charge d'Affaires, David Young, to provide his opening statement, and then we can get into your questions and answers. Thank you all for your attention. David?
Great, thank you, Sean. And it's wonderful to be with all of you. Greetings to all our friends in the media. Can you hear me okay? Sound good? Okay, thanks. It's interesting in this virtual world that we now live in. Sometimes you feel like you're talking into a box. So it's nice to get a thumbs up back. So thank you, guys. Thank you. I am actually a former journalist. And so my undergraduate degree was in journalism, and I worked as a newspaper reporter. So I feel like I have a lot in common with you. And I just want to give a big shout out to all of you as journalists, because you play such an important role in Zambia's democracy and just the advocacy that you do. So I want to salute you all. I've been here about 2 months as the U.S. Charge d'Affaires in charge of our embassy here. This is my second time in Zambia, because from 2013 to 16, I was the Charge d'Affaires and Deputy Chief of Mission during that time. And I think a number of you I had met during that period. So it's great to be back in Zambia. You know, it's when I hit the ground, I was anticipating working on a lot of different issues, but I didn't imagine we were going to be consumed with the COVID-19 crisis. So it has been a very interesting 2 months. During my time here, the United States government has really committed itself in great detail to working with Zambia to overcome the COVID-19 pandemic and to help Zambia fight COVID-19, the coronavirus, just in the way that we work as one of our main emphases, fighting HIV/AIDS, malaria, tuberculosis, and other diseases. Some of you may have heard, but we have just increased by 5 times our assistance that we're giving to Zambia and working together to fight COVID-19. And we're committing, as of now, 180 million Kwacha in our efforts to fight COVID-19. This is coming principally through 3 of our U.S. government agencies that operate here. The U.S. Centers for Disease Control, or CDC, the U.S. Agency for International Development, USAID, and the Department of State working with the PEPFAR program, the President's Emergency Plan for AIDS Relief. What I'd like to do is just to briefly outline some of the details about this assistance and then open it up for you for your questions. And I believe, Sean, we're going to have a fact sheet at the end that can provide more details, right? Some of the specifics?
That is correct.
Correct?
Yes, that is correct. We will share that at the end of the call, hopefully to share via Zoom. And if the journalists do not get that via Zoom, we'll definitely share that right away through regular email distribution. One of the housekeeping item I want to raise is that if for some reason you get disconnected from the call, jump right back on, just log back in. Thank you.
Great, thank you, Sean. So to give you some specifics about what our assistance, the 180 million Kwacha will be focused on, it's about 4 main areas. First, USAID is working in several spaces. One is to strengthen laboratory and clinical systems to help diagnose new cases and to treat people who are sick. So that's lab and clinical. And we're also engaged through USAID with education and informational materials through media and through billboards. You may have seen some of the billboards around town that we're helping fund that raise awareness about coronavirus. We're also working with UNICEF, AID is, to focus on infection prevention and control. This is largely to improve some of our hygiene and sanitation measures, because as you know, we focus so much attention in fighting coronavirus on hand washing. And if you don't have access to clean water, you know, how are you going to be able to engage with hand washing? So that's a key thing. We're also working with the Ministry of Health and different religious traditional leaders and Zambian partners, including entertainers and others, as part of an effort called Zambian Partners Against COVID-19. So that is an effort to raise awareness, to do public service announcements, to help get prominent celebrities involved. You know, we've seen people like Beeflo and others be out there, and we're doing in concert with some of our friends, like other partners and others, working with entertainers. But, you know, people like that are getting out there in this space too. The second area that we're working in, all those first ones are USAID programs. And the second is through our PEPFAR program that I'd like to highlight. That's the President's Emergency Plan for AIDS Relief. And we give a huge amount. The largest bulk of our assistance each year to Zambia is through the President's Emergency Plan for AIDS Relief. The HIV treatments that we do, one of the big issues that's connected to coronavirus is trying to make sure people get multi-month scripting. In other words, we want them to get up to 6 months of their medicines at one time, so they don't have to come back to crowded clinics where they could get exposed to people. Because you can't do social distancing if you have to stand in long lines to get your medicines. So that's a key thing we're working on through the PEPFAR program. And then thirdly, focused on CDC, we do a lot of technical assistance and cooperation together with CDC and the Ministry of Health. So we're working with the ministry, ZNPHI, UTH, University Teaching Hospital, on a variety of things such as technical and financial support, helping establish the COVID surveillance system, developing isolation and quarantine guidelines, and helping do best practices and training with healthcare workers. So it's a large amount. Some of the most important work we do in country is this cooperation through CDC, very closely, brothers in arms, if you will, with the Ministry of Health. I've met many, many times with the health minister since I've been here, with the PS, others, to engage closely on kind of healthcare policy. So our cooperation and partnership is really strong in that area. CDC has also established some of the laboratory capacity, working on the infrastructure with UTH and the Tropical Disease Research Center for HIV and TB. And what we've done is help to convert some of that infrastructure to be able to use for lab capacity with coronavirus. So kind of transitioning some of that lab capacity that already exists to adapt it for the COVID fight. And also, we're doing with CDC COVID training for healthcare workers. We've established a call center at the disaster management and mitigation unit, where people can make phone calls to do contact tracing, to follow up if somebody was on one of these airplane flights. For example, the flights that came from Pakistan or Paris, just to check to see if other passengers on that plane had started to develop symptoms. So that's the call center and the contact tracing. And so we've also done training, in terms of the daily work of healthcare workers and the monitoring. So that's some broad mix of those areas. Again, with USAID, the PEPFAR program, and Centers for Disease Control. So that's kind of a good broad overview. Again, some of those details are in the fact sheet that you'll get if you haven't already gotten it. But I wanted to open it up for some questions and look forward to a good dialogue with all of you. So thank you very much.
Thank you, sir, for those remarks. At this time, we open the floor for questions. Have not seen anything via chat yet, so if someone wants to raise the first question verbally, please do so. Mumba, are you trying to speak because you are on mute?
Yes, I was trying to speak. Thank you.
Good afternoon.
Good afternoon, Mumba.
Yes, James Kunda from the Times of Zambia in Lusaka.
Okay, go ahead, James, ask your question. Sorry, Mumba, we'll get to you second.
Okay.
Yeah. My question to His Excellency is, are we now seeing a repaired Zambia-US relationship following the country's fallout with the erstwhile ambassador? Thank you.
I would describe our relations as good and solid right now. I think that our health cooperation really indicates that we are strong partners in combating this transnational threat, this global threat of COVID-19. And if you look at our partnership on health, it is deep and extensive, and it makes a big difference together. So I think in my 2 months here, we've indicated by our actions the extent of our deep partnership and friendship. Like any partners and friends, you'll have bumps in the road. That's natural. We feel strongly about issues, and the Zambian government feels strongly about different issues. But our health partnership reveals we are good partners. We have been good partners. We are good partners. We will be good partners into the future.
All right, Mumba, before you talk, I would like to remind everyone, if you are not speaking, please mute your microphone. And we encourage everyone to turn on your video at least so we can see your lovely faces. Go ahead, Mumba, state your full name and your organization and your question. Thank you.
Oh, yeah. Thank you very much. Good morning that side and good afternoon here in Zambia. My name is Mumba Ngoma, coming from a civil society organization that does TB and HIV work. A lovely presentation about what USAID is doing. But my question to you is, I have not seen a very serious outline in terms of civil society involvement in the COVID, HIV, TB issues. What is your position?
Sure. I think the fight against COVID-19 requires all of us to be in and work together. It's like if we're pulling oars in the boat, we need to all pull together, and civil society plays a crucial role in that. I think what's happening is we're responding very quickly and actively, trying to do testing and contact tracing. The surveillance is an urgent priority to do with healthcare workers and the ministry, where it's like, I don't know if this makes sense in the Zambian, American translation, but there's a game in the United States at amusement parks that's called whack-a-mole, that a little thing pops up and you have to hit it down and you move real quick. Trying to respond so quickly to this spreading pandemic, it requires quick action. And so some of our priority action is working with the health ministry, health workers to respond very fast. I think civil society plays a very important role in informational campaigns, helping educate the public, helping people to be aware. You know, that is a crucial role of civil society. Like with traditional leaders, religious leaders, others, we need influencers like you, Mumba, and others who are aware of the issues, who can educate the public of the importance of health and hygiene, and can also tell people that if you're sick, stay home. If you're sick, don't go to the hospital. Call a health facility, because you could unintentionally spread the virus, if you go to a busy area. We have to educate people that this is a serious virus, and you really can't all go to the marketplace like before. I think it's been very impressive that, churches and mosques and, certain gathering places like restaurants and bars and others have been closed, or people have been observing social distancing. Civil society can help us pass those messages, and that is absolutely crucial right now.
All righty, yeah, we see that some members of civil society got access to the link. And so I just want to say we welcome the questions from civil society, but we would like to prioritize those from working members of the media. So Alex, I see you have your hand up. So if you're, state your name, organization, and your question, please.
So make sure to take yourself off mute, Alex.
Oh, my name is Alex from the Zambia Daily Mail. Yeah, I've got two questions. I'd like to find out from you, the American government has voted this financial support to the World Health Organization. Does this have any effect on Zambia in terms of the support that you give to Zambia? And I just want a clarification on how much money have you committed to Zambia towards the fight against COVID on the 180 million? Just a clarification.
Sure. Well, first, on your second question about the clarification, the complete total of 180 million Kwacha, it's Kwacha, 180 million Kwacha, all of it goes to Zambia, all of it. So, and all those programs that I described, those 8 or 10 programs, all of those are in Zambia. So we have a very broad and vast, partnership. And I must say, I'm not trying to brag about it, but, we're the biggest partner, in the fight against COVID-19. We give a wide range of assistance. We're working very closely together. And again, this comes out of that deep cooperation we have in fighting HIV, AIDS, and malaria and TB. With regard to the WHO, President Trump made the decision and announced a halt to US funding of WHO. And this was in order to review the handling of the coronavirus outbreak, because our health officials in the United States had some concerns, and President Trump has those concerns about how WHO was working in the coronavirus response. Because we're a big donor, we want to use every dollar, every kwacha of our assistance in the most effective way possible. So the thinking was that our taking this action is ordered to use our funds most effectively so we can save the most lives. So it's about effectiveness of using our money. So we want to make sure that our money's targeted to key programs. Just to emphasize, we believe we can give this assistance quickest and most effectively if we do it bilaterally, between us and other countries. So rather than go through the WHO, the feeling is to go straight to a government and straight working together. Just to emphasize, all this money we're giving is part of a huge investment in health that we're giving to Zambia in many areas. But we felt that it's best to do it directly and quickly.
Okay, our next question is going to come from user, I guess that's, ITEL IT1703. So please state your name, your media organization, and your question. ITEL IT 1703, unmute your microphone and ask your question, please.
Hello.
Hello.
Yes.
Hello, Shane.
Yes, we can hear you. Hello.
You can get me?
Yes.
Yes.
Hello, good afternoon.
Good afternoon.
Good afternoon, sir.
Good afternoon.
I hope you are hearing me clear and loud. Eh?
Yeah, pretty good. Yeah.
Your Excellency. Okay, thank you. Thank you. Ndimba Monga are my names. I'm a community activist. At the moment, I'm the board chairperson for Population Council, which is a research team. My concerns on the donations which we are receiving as a nation to fight this COVID-19. As a community-based person who is on the grassroots, we've seen a lot of donations coming into Zambia to fight this scourge. Unfortunately, they are not reaching the ground, the grassroots. So if you want to fight the scourge, it should trickle down to the grassroots. If the grassroots can't nations, they can see the actual materials given to the people to fight the COVID. I'm wondering if we achieve the goal to fight this war we are facing. So I don't know what you can comment on that one, Your Excellency. Because many things have been received by Zambia, and the people have been promised we will give you the things. We go in the field, things are not reaching the communities. How can you come in as Your Excellency concerning these things are not distributed equally to the people? Thank you.
Okay. Thank you for your question. I think the thing that I would say is that I have seen personally over the last 6 weeks or so, when we've provided our increasing assistance, is that our money is having an impact. That 180 million kwacha, I've seen that some of the cases that have been identified, in fact, many of the positive cases that have been identified is because of the very close cooperation between the Zambian government and our Centers for Disease Control. So our coordination on surveillance, testing, case finding, follow-up, those things that I mentioned, they have helped identify many of those cases because of our partnership working together. Like I said to the other gentleman earlier, I think that, you know, the role of civil society, people at the grassroots is huge. It's hugely important in every way. You know, our assistance is not to the exclusion of other people's assistance or other kinds of cooperation or the work of activists and advocates. All of that is important too. But I would say that, you know, to get this kind of response, if you look at the way COVID-19 is being fought around the world, whether from Asia or Europe or the United States, you know, when you look at the response of how it's been fought, or South Africa or Egypt, there is a very important aspect of working through the health systems of the government, through hospitals and government health ministries and others, to make sure there's a quick response and an effective response. So again, it's not to say this is important, but this is not. It's all important, but we really have to focus quickly on making sure that health ministries and hospitals and health workers have the ability to respond in effective fashion. So I would really say, with all due respect, that I've seen that our assistance has already had some good results. And I think the people we've worked with, whether Minister Chilufya or PS Malama or Dr. Makana, you know, Makanka of ZNPHI, or healthcare workers, or even President Lungu, have acknowledged that our assistance has made a big impact. So I would say it is making an impact for the good.
Okay, thank you. Do we have a question from a media organization? Just go ahead and speak. If you're a media organization, just take the floor and raise your question, please.
Hello.
Go ahead, Mary.
Good afternoon, Your Excellence. My question is on the effectiveness of the fight against the coronavirus. Would you recommend a total lockdown of Lusaka, for instance, to ensure that the spike that we've seen in the recent days goes down? Have you maybe discussed that with the Minister of Health? Thank you.
Mary, did we catch your organization? What's your organization?
Daily Nation.
Okay, thank you. Go ahead, sir.
Thank you, Mary. I think it's a very good question, and it's a very hard question, very difficult question for the government. I think there are arguments for and against a complete lockdown. And I personally think the Minister of Health and the government have made some good decisions of walking the line about how they've done that. It's certain countries have done a total lockdown. You know, you can look at, for example, in the United States, some states have almost completely locked down, others have not. Here in Southern Africa, some countries have locked down, others have not. I think one of the big challenges, and President Lungu referred to this just yesterday, I think, is that you have to balance the public health requirements and aspects with the economic impacts, especially on the poor. Because it is very difficult to, when you have a complete lockdown, it makes it very difficult for people who live in the compounds, for example, to be able to get food, to go to market, when they don't have refrigerators at home, when they're in houses where it's difficult to isolate. So trying to balance the economic impacts with the public health impacts is tough. And you know, in the United States, we're wrestling with that now. President Trump and our governors are looking closely at that as well. So I would just say it's a tough balance, and a lockdown it's a difficult decision, but I appreciate the efforts the government has made to this point.
Thank you. I want to let everyone know that we have under 10 minutes left in this Zoom call, so we might get cut off, but I want to raise up one question in the chat that we did get from a civil society member. So Chilufia Hampongo of the Treatment Advocacy and Literally Campaign asked whether there are any plans to engage with community-based organizations to disseminate the information to communities, knowing most stakeholders may concentrate on strengthening the clinical aspect of the fight against COVID.
I would say that one of the important initiatives I described was the USAID funded project with the Ministry of Health and religious, traditional leaders, civil society, private sector, and others in the project called Zambian Partners Against COVID-19. This project of Zambian Partners Against COVID-19 is a broad-based effort that civil society can play an important role in. So that would be my suggestion. And we can certainly, for our civil society partners, if we be in touch with Sean or Julian or others, we can help put you in touch with some of our AID people to be aware of this initiative.
Okay, who else wants to ask a question? We actually have we have about 5 minutes left on the call. Feel free to directly speak up. No one?
Well, maybe Sean, I'll make a last statement real quick.
Yes, sir,
Yeah, I'll just say to all of you, once we get through the COVID crisis, I look forward to meeting in person and we can chat about a lot of issues. I'm looking to start doing Facebook Live sessions weekly, and you'll see some of those on our embassy website. And we look forward to doing other engagements with you in the press in the coming days. So we'll have lots of other opportunities to talk. We have several world celebrations or commemorations this week. Yesterday was the 50th anniversary of Earth Day. And on Saturday, we have World Malaria Day. So next week, we'll be talking about some of our assistance to fight against malaria here in Zambia as well.
Thank you.
All right, thank you for that, David. And if you all wish to, we're trying to get out the press release to you, the fact sheet. You'll either receive that via email or on this chat, this Zoom chat. So if you stay on, we'll probably be able to upload it so you can get first peek, and then otherwise we will disseminate to you shortly. And if the chat ends, then you'll get it via email. Thank you. Thanks a lot, David. Thank you all, everyone, for joining.
All the best. Thanks, everyone.
Thank you.
Goodbye.
Thank you.
Thanks very much.
Bye-bye.
Bye.